Fresh 93.1 FM, beyond expectations. And yes, you're still here. And I'd like to make some confirmations and put the calls across because whilst we're talking, the phone lines were actually buzzing. And I believe some persons might want to know and make confirmations and just know some things that they want to ask our reps here in the studio. If you want to be part of this, you could actually put a call across on 081 888 or 0022931 is if there's any question that you would like to ask them about this disease, the leprosy, call us. Or better still, you could also send in a message on the line 081 888 Mr. Alexander, I know you have lots to talk about. Yeah. I know that you never been a fool.
No, never been a fool.
When we were talking, it was like, bro, my time never finished.
I best come here.
That was like the first half of the conversation. People are already calling now. Should we just take calls?
Yeah, let's take a call.
Hear from them first of all. Hello, good morning. Yes, good morning. What's your name? Bless you. What's the name and where are you calling from?
Thank you very much. Okay. Hmm. Okay. 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 So for me, thank you for
Thank you very
listening
much.
and paying attention. Okay, the way that leprosy will show in our body is first one is that your normal skin, you now see say some part of it change color. The color is going to change to is usually lighter than your normal skin. When it begin to happen like that, and you can feel that when you touch it, take your finger, just run across, you know they feel like say they touch your body. Now the first sign of the leprosy is that. That's the first time it will show. It can show as only one patch, or it can show as many patches in different parts of the body. Okay, but once you now know that that patch, when you touch it, you know the feel sensation, know that that is likely to be leprosy, and do not sit down at home because it's a beginning. And once you sit down at home and then you allow it, and the germ can't enter inside the nerves, can't destroy the nerve, that is when it gets to a stage that we can treat the disease, but we cannot treat the complications that will come. So the other things that you will feel is that some of your nerve will now pain you. That there's some nerve that run across the joint. Then because of the swelling and pain in that nerve, you can feel pain in the joint, which you might call rheumatism, but it may not be rheumatism. So any person when they get joint pain, it still need to be checked whether this can be leprosy or is possible. Not that leprosy is very common, but because of the way they affect human beings, that is why we dey push say we must come out from our society.
So don't feel the fear that an abomination or
no,
man will do leprosy test.
No, not be so. Once you have, because once you are treated when the thing never damage you, nobody will know that you have leprosy.
No.
It is when it don't damage you. In fact, it's the damage that people know say this is leprosy, but it's not the damage that's leprosy. So two things: your skin, then the nerve where they pain you, and then loss of sensation in your hand and in your feet. When you come the waka now, you know they know say you dey mash ground. And that one the damage don't dey increase. At that level, wound go begin enter, you will not know say you get wound. You go kick something, you go hold something, you don't know say you dey hold something. That is, you don't dey go to dangerous level. So the main thing is that the patch will be there, There'll be pain across the joints if there is a nerve that is affected there, and then the loss of sensation. Other things that damage, like your nose go come change, your eye go come dey change. Some people go come dey blind, and then some people they no go fit get pikin again because it dey affect testes. When e affect the testes, the man no go fit produce pikin again. Some people, some men, they come dey begin dey get big breasts because the testosterone wey dey come from the testes don destroy, you know the face. So the people, men come dey begin dey get breasts and all those things. Those are difficult extent when complication with it.
We actually okay. Thank you very much. He also posed a question to Mama here in the studio, asking if you are completely free or other things they said about the government. If it's true, I need you to allude to that. I won't make you tell them whether not true or not be true.
Really, thank you very much. Before I come answer this question, you get on one thing make you una know. At times you get blister. Fire not burn you, but you get blister. So if you then they get that blister, even patch no dey, but you get blister, you go still try come for checkup because that blister fire not burn you, but you just get blister. If you wear tight shoe, you can't see blister. No be that shoe give you that blister. That is sign too. That's all. So the area when I come dey talk about this government, they say, you see, like at times that if you come inside our own side, if you come for our camp, maybe they don't hear that, let me then put us for there. But if we go out now, say maybe they find work, if 5% they're supposed to give us as the less privileged people, you go say they go say no, not be our face, this leper person go work. Oh. You understand? So that was they deny us that part again. And this time now, even the women affairs wey dey take care of us see they add more problem to our problem because women affairs you see this what's called Jonah, we as we dey inside Jonah dem make all those disabled people too dey fear us because when dem go we suppose to be among the 5 group, the disabled 5 group among, but you come tell dem say na we dey take care of dem, no dey comot for outside. Then we suppose to tell dem say dis people are heal o, because of the long throat wey dey inside small, the things wey those people suppose to give us, even other organization go give us, dem go come collect am still put for their own small. Dem go come say na dem go come bring am, if na 10 bag of rice o, na 5 bag of rice o, I bring 5, dem leave the rest for us. No suppose to be so. That's women affairs. So for this, even this year, they no even give us anything at all at all.
Okay,
But
are you free from the sickness?
yes, the treatment of the the treatment wey I don take, I don free in everything. Even when you say I get my decide paper since for long ago, so and no, that drugs when I take, I don free.
Because I want us to make a clarification on this.
Okay.
Let us buttress on it more. Is it a curable disease?
Yeah.
Because it feels that she was making a statement
Yes.
and I said, this one a leper. It's just like when you've been infected, you cannot be cured anymore, or you're just there faced
So
as
that's
a
the point.
leper.
I've been cured. I don't really cure, but when they make people they think say they're not cured because then they see that ulcer. Every time we see they make them, they know say once you don't begin take that treatment, once before na 2 years, 3 years, but when the German leprosy people come look and say no, the time too long again. They come make the drugs, give them the drugs. So they take now, it's only 1 year.
1 year.
If you can take it for good that 1 year, you know come on, you know everything. You go see say once you go for test again, you are free. I am free.
You are
And
free.
I thank God, I'm
And
free.
you are
I'm
free.
free.
Indeed.
Remember that God has said free, free, free.
Guys, please put those calls across if you want to reach them, ask questions at 01 at 0022 We've got a call here. Let's see what this person has to say. Hello, good morning. That's you. What's your name? Where are you calling from? Frederick from Orugu.
Thank you very much. God bless you. Okay, fine. Because
Thank you very much.
well,
I think you've spoken about the
yeah,
germ.
the
It's
germ
airborne.
is actually a bacteria, not a virus. And that bacteria is like me with you come life. Now, so that bacteria too come life. We
Yeah.
don't know why the bacteria come life. So, but that once that bacteria enter into your system through your breathing system, then you can get infection. The luck we have is that many more people for even get am, but if 100 people breathe that germ inside, now only about 5% now they get the sickness.
Okay.
So it's not as if we
It's
should
not
actually run.
highly
No, it's not highly
contagious.
contagious. Only that one, the people will get and they get damages in their body, and then people will now stigmatize against them. That's why we are fighting this battle. Like as it is now, even if they not treat the person, if the person gets children for us, the children may not even get it. And but only that there are certain proportion, especially when the body, the way to fight sickness, what we call immunity, it goes down, and then the person might get it. So it's not really a disease that we should run away from as we are running away from it now. Okay, so we need to know that, and then and to say that we can eat with these people, especially after they have taken their treatment. The germ is no longer there. If the germ is not there, they cannot transmit it to another person. So you can eat with them, you can use the same spoon, you can use the same cup, you can sleep the same bed with them. Because if somebody that is burnt by fire, if you sleep with them, it does not mean say your body will be like, that's the way we're supposed to look at this matter. So please feel free to eat with the people, shake hands with them. Because when we see some of them with their hands that are the phone, to shake hands, go. But not be really saying you shake hand, the thing will jump into you. No, but it's just your sensation that what do I But so we need to understand this. That is why the people can come to our society, live in the community. There's a man that we treated, I think whether he had amputation or something, but the community have taken him back. Is the head of the community. Is the one that's going to be pouring libation if they are going to do libation. That is in this place that they come for meeting. But it's a leprosy patient that we have treated. So these people, we can accept them. We should accept them.
Before you continue, I would want to, because they have a camp, yeah?
In the referral center,
yes, they do have a camp.
They have a camp.
What's the government doing? This for you. What's the government doing in integrating these people into the society? Do you go there to sensitize them? Because some of them, they receive their treatment and they still return back there, and they feel like it's not in my place to come back to the society. Being normal persons are.
Okay, fine. You see here, why I thank you for that question. You see, the other area for other states like Enugu, that's Oswakole, after they discharge on this, they build house for them, they take them to town. But here now, nothing like that. After they just take us down to camp. If you like to, if you feel survive, you survive. If you not feel survive, well, God will bless you. And you know, when you are poor, you can't go back to your family because they not even fit carry their own wahala finish or problem or everything than so what is keeping most of us inside that place is poverty. If you have money, you can go out and trade and do other things. Nobody will even know. But because of nobody to help you, no rehabilitation, nothing, that is just the problem. If somebody, a company or anybody can come and say, okay, let us give this, let us rehabilitate these people in a good way. Not one bag of rice, so then one with one tin of milk. Then you say, I don't rehabilitate this, so you go to your town. You can't pay for house rent, you can't pay anything. It is zero. So if they come out fully to rehabilitate, you will find out that everything will be all right. But now, government are not saying, even these women affairs are not doing anything like that. They send us that go to school, but they don't send us to
They do
school.
women affairs.
Yes.
What they do for you, they're not going to do for you.
And they're not do. They're not doing
You have something to say.
I want to
Also
say that
rehabilitate us.
I want to say that why government is keeping them is that because many people, we have treated many people, they have gone back to their home, those that are not deformed. But because there's a proper deformity in this, some of them, they can no longer walk. They can no longer do anything because their hand has already been amputated. Some of them, even the two legs have been amputated. So they cannot do anything. Since they cannot do anything, what will government do? Because these people will be displaced people in the society begging on the road because they cannot do anything again. They will be begging people so that they will not become public nuisance to the government and to people I saw to the government now form a settlement for them where e can gather these people and be giving them small stipend and food so that they can put something in their mouth. That's why government put it. That's what government is doing for them, and government is doing more. I'm still begging government.
Yes,
I'm still
it's a
begging
call.
government.
It's a clarion call to the
Yeah,
government to do more.
Yes,
You
yes,
understand?
yes.
Yes.
But please, we need to put a new dimension to that. Initially, that was the main reason why they put settlements. But we know that it's not every person that is amputated that goes to a settlement. Those who are not leprosy people that are amputated, do they go to settlement? No. So the teaching is now that no leprosy person that have been treated and is certificated to be free, whether it's disabled or not, should be in a separate camp. Because separate camp means that you are creating another world for them.
So,
They are not integrating with the normal world. So their psyche is different. The way they think about things is different. So they have suspicion to people who are coming to see them to bring, as my sister said, bring bag of rice and say you are having no. So they feel that you are not really part of us and we are not part of you. We want to remove that strange feeling. So any person that have been treated, have been certificated, can go back. Even if the government have to help the person, it can help it in the ambient of his family. Okay, this is a person that we treat as so. Please, can we build a small hut for her? Maybe a self-contained. Let him be there, and then maybe start a small trade for the person so that it doesn't have to go apart. Those things can be done, but let it be done in their environment where they have their brothers, they have their sisters. But that will also mean that we need to remove the stigma that come from their own family. There are people that have died in the TBA camp that their relative will not come to collect the cup say because it's a leprosy person. So we need to remove all these negative feelings. Yes, and government should help the people in their community, not in settlements.
Yeah, the government can actually do more. I believe the government can do more, but I also still feel that the patients themselves, can do more because, like you said, you make soap.
Mm.
You're self-sufficient.
Yeah.
You try to liberate yourself and
Yeah.
say, okay, and you're not just sitting down, cross your legs, say, government never do for me. You understand? So it's also a call to the patients to you could actually do something for yourself because if not everybody touch. When we say there's no money,
yes.
it's
And
everybody.
everybody, government is crying, individuals they are crying. But
Exactly.
also to be fair to them,
Yeah.
in the camp, many of them do a lot of things. Some of them go to farm. It's not good for them because of the lack of sensation. They will usually come back with injuries. But there are some of them that are riding motorcycles. There are some of them that are even some of them bought vehicles for transportation, and they were using them before. There are some people that have done fish pond and all that. They are doing that, but they need to be helped them more so that they can cope for themselves better. That is what we are actually saying.
For. Thank you very much. Guys, you can still call in 01 888 0022931 931. Do you have a question that you want to pose to those the refs that we have right here in the studio? Don't worry, you are free to do that. Have a call. Let's see. Hello, good morning. Good morning. What's your name? Where are you calling from? All right. Talk to us.
Okay. 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 That's two questions now, not three. Then. Okay. 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 Thank you very much. So you've been following us. So the first question is what was that thing now?
It asked about if what's the duration.
Okay,
the
yes,
duration.
okay, yes. Okay, duration. The duration is actually wide because it's a slowly growing bacteria. But it said that within 1 year to 2 years, most of them 5 years, it will show. Okay, But sometimes it can stay as long as 20 years before it will actually show. So you would have even forgotten where you were when you contracted the disease. So it's a slowly growing disease. It does not show immediately. It takes a lot of time before it shows. So that is the answer to that question. Then for the other one, whether
Whether
it's
it's hereditary.
no, really, it is not hereditary, because although there are some studies that say that maybe the mother can pass it on to the child, but that is very rare. We really do not put our head in that is hereditary. The only thing that we can show scientifically that is making the disease to spread is that if somebody who have it can pass it to another person in the air. So the person who breathes it in the air, it's not because you actually wear the clothes of the person, that is why. It's not because there is a rat that is biting you, or cockroach, because that's what some of the myth we say that cockroach just bite me, now the thing show. Some say na rat bite me, now the thing. It's not so. But you breathe it in the air, and then gradually it starts to show up in your skin, in your nerve, and other parts of the body. So it's not really hereditary that because your father have, then you must have. Even though you are in London and your father is here, you'll get. No, that is not the way it is spread.
All right, thank you very much. I hope you had clarifications, very, very clear clarifications with that one. You can still pull those calls across 01-888-931-0022931-931. But I like the fact that the government is doing something about it, even if it's not tangible enough for Mama that we can't yeah,
Let me say something for women affairs. I think that they have tried a little, although they can try more. They have been visiting them. They erected a water tank for them, and they have also repaired some of their houses and all that. So they are trying a little. Only that we feel that they can try
do more.
better.
Let's take this call before we run off. Hello, good morning. Yes, good morning. Be greeted to you. What's your name? Where are you calling from? All right, 1 minute. Talk to us. Mm. That's your only question, yeah? Okay.
Okay.
Guess he wasn't listening. But all right.
No, the sickness is not hereditary. If papa get am, the papa don late, maybe later the pikin go come out for the pikin body. No, not be like that, because the thing na bacteria, small small something that are in the air, micro. They are bacteria that are in the air. When somebody inhale it, you breathe it. Maybe somebody that have it cough directly to you, or breathe, or he spit, or he sneeze, and somebody inhale it, and when that person inhale it, e enter the person's body, and e manifest, and e show in the body, in the skin. But now that somebody that have it before, maybe it's not treated and it's dead, e don die, it's a disease, e don go away. So if e born pikin before, e no get am before e die, no way that sickness can come out in the body.
So maybe what happened is that the child actually had it from the father before the father died. But it was after the father died that it now showed up.
Okay, we're out of time already. I need you to give your final word because the news comes in.
Okay.
Your final word.
All right. So what we are saying is that please, we need to be aware of the signs and symptoms of leprosy that every person needs to know, and every person needs to go back and find in your home, in your house, your husband, your wife, your children, the people who are coming to your marketplace to do. Do they have just sell the market, sell the gospel to them, so that every person can go back and check himself, and that every person should know that in most hospitals, just go there and say, I have this patch. There will be somebody that will attend to you and how to diagnose it and how to begin to treat it. So nobody should carry
And
those
it's
things.
free.
Yes, and it is free, please. If there is any person that is taking money because of that patch that you get there, the numbers we gave, so just call those numbers. We will attend to you.
All right. Let me call those numbers
Yes,
again,
we
please.
will attend to you.
070-368-92661 or call 080-605-11271. And for Mama here, 070-604-5444. 40582. So if anyone is saying you must pay this one, please make sure you call these
Yes.
numbers because we need to nip this issue in the bud. Thank you very much for stopping by this morning.
Thank you very much.
I really do appreciate it. Mama,
God bless.
God bless you. Thank you very much.
Yeah,
sir.
thank you very
Yeah,
much.
All right. All right, guys, it's
Thank
on
you
to
very
question 3.1 FM Beyond Expectations. The news comes in a minute.
Thank you very much.